Okay, welcome back to the deep dive. Today, we're embarking on a focused mission. We've got a stack of revision notes here, and we're going deep into zinc deficiency.
Yeah, I think of it as us unpacking these notes together,
Yeah.
really trying to pull out the absolute must-know, high-yield stuff, fast, effective.
Exactly. For your own learning, maybe revision,
Yeah.
and we're sticking strictly to zinc deficiency, what it is, the causes, management, the whole picture.
And look, you might think, zinc, how important can it be? But honestly, it's huge.
It really is. It's involved in, seemingly everything. Metabolism, immunity, even basic things like taste and smell. It pops up everywhere.
So let's start with the basics then, a definition. Zinc deficiency is, simply put, when the body doesn't have enough zinc, inadequate levels.
Right. And inadequate feels like an understatement given its job list. You mentioned metabolism, cell structure, growth, DNA, immunity, wound healing.
Taste, smell, yeah, the list goes on. It's not just a nice to have, it's fundamental.
Foundational.
Hmm.
And thinking practically, how does the body handle it? Where is it absorbed?
Good point. Yeah. It's mainly absorbed in the duodenum, that first bit of the small intestine,
Yeah.
which, immediately flagged potential issues if there's gut damage there.
Ah, okay. And getting rid of it.
Primarily excreted in feces.
Got it. So how much do we actually need day to day? Are we talking large amounts?
Not really. The recommendations are around 9.5 milligrams a day for men, 7 milligrams for women.
9.5 and 7.
And the total amount in an adult male body is surprisingly small, only about 1.4 to 2.3 grams overall. It's tiny.
Wow. That little amount doing all those jobs, it really highlights its potency, doesn't it?
It really does. And where do we get it from? The classic sources are things like red meat, poultry. Oysters are famously packed with it.
Oh, that's right.
But also nuts, legumes, dairy, and fortified cereals increasingly.
Okay, but here's a key thing, isn't it? Something that can trip people up with absorption.
Yes. Phytates. You find these compounds in plant-based foods, grains, legumes.
And they interfere.
They can bind to zinc and significantly reduce how much your body can actually absorb. It's a really important factor, especially when considering vegetarian or vegan diets.
Definitely one to remember. That phytate-zinc interaction. Okay, so moving on. Why does deficiency happen? The etiology.
It generally boils down to one of four main reasons, really. You're either not getting enough in your diet,
Simple inadequate intake.
or you're not absorbing what you do eat properly,
Impaired absorption.
or your body suddenly needs more than usual.
Increased requirements like pregnancy.
Exactly. Or, finally, you're losing too much of it. Excessive losses.
That covers pretty much all the bases and specific causes within those.
Well, poor nutrition is the obvious one for intake. For absorption, think conditions like celiac disease, Crohn's disease, anything damaging that gut lining.
Makes sense, given it's absorbed in the duodenum.
Chronic diarrhea is another big one, literally flushing it out. Alcoholism is significant. It hits both intake and absorption. And certain medications can interfere too.
Right, so knowing those causes helps us pinpoint who's most at risk.
Precisely. The risk factors. So, inadequate zinc intake, obviously. Especially diets low in animal products and high in those phytate-rich plants.
You keep coming back to those phytates.
They're important. Then, malabsorption disorders are a major category. Any kind of gastrointestinal surgery can pose a risk. Chronic diseases, particularly inflammatory ones. Alcoholism, as we said. Certain meds again.
And there are specific groups who are just generally more vulnerable, aren't there?
Yes. Infants and young children need a lot for growth. Pregnant and breastfeeding women have higher demands, and older adults often face challenges with diet or absorption due to other health issues.
Okay. And are there other specific medical conditions that really ramp up the risk?
Definitely. This is key for clinical suspicion. Think chronic liver disease, kidney disease, sickle cell disease is another one, diabetes.
Wow, quite a list.
Yeah, and as mentioned, strict vegetarian or vegan diets if not carefully managed. Even high-dose iron supplements can sometimes interfere a bit with zinc absorption, though usually less of a factor than the others.
That's a comprehensive list. It really tells you who to keep a closer eye on for potential deficiency.
Absolutely. That list should trigger a thought if someone presents with sort of vague or multi-system issues.
Okay, so we know the what and the why. Let's get into the how. How does low zinc actually cause problems, the pathophysiology?
Well, zinc is just crucial for enzymes. Hundreds of them. It's needed for making DNA and RNA for cells to divide properly.
So basic building blocks of life, really.
Pretty much. Immune cell development and function rely heavily on it. Growth, tissue repair, it's everywhere at a cellular level.
So if zinc levels drop, It's like taking a key component out of countless machines all at once.
That's a good way to put it. It disrupts all these fundamental processes, leading to this cascade of problems throughout the body.
And that explains the symptoms we see.
Exactly. Take rapidly dividing cells, skin, hair, gut lining. Impaired DNA synthesis hits them hard. That's why you get dermatitis, hair loss, diarrhea.
Ah, okay. The link is clear.
Impaired immune function means more infections. Its role in neurotransmission might explain some cognitive issues. It all ties back to those essential roles we listed at the start.
Right, connects the why it happens to the what you see. Okay, but before we list all those symptoms, it's worth pausing, isn't it? What else could look like this? Differential diagnosis.
Crucial step, because some symptoms are quite general. Fatigue, maybe poor growth.
So what else is on the list?
You've got to think about iron deficiency, vitamin B12 deficiency, and general protein energy malnutrition. They can all share some overlapping features.
Makes sense. So knowing the specific signs of zinc deficiency becomes even more important to tell them apart.
Absolutely. Recognizing the overlap is step one, but spotting the unique zinc clues is step two.
Okay. And how common is this, epidemiology-wise? Is it something we see a lot in, say, the UK?
Widespread severe deficiency isn't that common here, unlike in some developing countries where overall nutrition is a bigger issue.
But we do see it.
Oh, definitely.
Yeah.
But typically within those specific risk groups we talked about. People with known malabsorption, like Crohn's or celiac.
Mm.
Individuals on very strict, maybe unmonitored vegetarian or vegan diets.
Right.
And sometimes people with very limited food choices for various reasons, perhaps socioeconomic or other medical restrictions. So yes, it's definitely present in the UK, just more concentrated in certain populations.
Good to know where to look. Okay, let's get to the clinical features. What does zinc deficiency actually look like in a patient?
Right. And remember, it's a spectrum. Mild deficiency might just be subtle things, whereas severe is, well, unmistakable once you know what you're looking for.
So what are some of the more common, maybe less severe signs?
Things like impaired wound healing cuts just taking ages to close up, skin issues like rashes or dermatitis, hair loss, what we call alopecia.
Okay.
Chronic diarrhea can be a big one. In kids, poor growth is a major flag. That altered taste or smell we keep mentioning. Weakened immunity, so getting infections more often. And sometimes cognitive things, brain fog, poor concentration.
Pretty broad range already. But you mentioned specific classic features, the high-yield ones for recognition.
Yes, these are the ones that should really make you sit up and think zinc.
Give us the red flags.
Okay, top of the list probably. Perioral dermatitis. It's a very characteristic rash, often crusty, specifically around the mouth.
Around the mouth, got it.
And then acrodermatitis. Now, acrodermatitis enteropathica is the inherited form, severe from birth, but you can see similar skin changes in acquired deficiency too. It tends to affect areas around body openings, mouth, anus, eyes, and the extremities, like fingers and toes.
Well, specific locations for these rashes, mouth, orifices, hands, feet. What else is classic?
In children, short stature is a big one, and hypogonadism, delayed puberty. That links streak back to its role in growth.
Right, the growth connection.
You might also find hepatosplenomegaly, enlarged liver and spleen. And then there's a really curious one, geophagia.
Geophagia. Eating soil. Eating clay or soil, yeah. It's thought to be this instinctive drive to get minerals the body is lacking, often linked strongly with iron or zinc deficiency.
Wow, that's a memorable sign. Eating dirt, okay.
And alongside that, significant cognitive impairment can be part of the classic picture too. So yeah, that combination, short stature, delayed puberty, weird specific rashes, eating dirt, cognitive issues, that pattern screams zinc deficiency.
It really does, a very striking cluster of signs.
Absolutely. And then in severe cases, things get much, much worse. It's a systemic breakdown.
Okay, what does severe look like?
You see profound anorexia, just no appetite at all, extreme lethargy, persistent severe diarrhea that's really hard to manage, massive growth delay in children.
That's awful.
It is. The immune system becomes severely impaired, making simple infections potentially fatal, major issues with sexual maturation, severe widespread hair loss, and really extensive, often painful dermatitis.
It affects everything, pretty much. Cognitive problems worsen significantly. You can even get peripheral nerve damage, numbness, weakness, serious weight loss, eye problems like macular degeneration, profound loss of taste and smell. Wounds basically don't heal. And it can mess up iron absorption too, leading to a secondary iron deficiency anemia on top of everything else.
It's a multi-system catastrophe, like you said earlier.
It truly is. Recognizing it before it gets anywhere near that severe stage is absolutely vital.
Okay. So You suspect it. You've seen the risk factors, maybe some of those classic signs. How do you confirm it? Investigations.
Right, and this is a really key point, especially for exams and practice. While we do have lab tests, the primary diagnosis relies heavily on clinical signs and symptoms, plus the risk factors. Clinical suspicion is king here.
So the blood test isn't the definitive answer.
It's not the be-all and end-all, no.
Yeah.
And this is the crucial bit to grasp. We measure serum zinc levels, sometimes plasma. Occasionally people look at hair or nail levels, but blood is most common.
There's a big but, isn't there?
There is. The serum or plasma level might not accurately reflect the body's total zinc stores, the amount actually available in the tissues where it's needed.
Ah, okay. So the blood level could look normal, but the cells are still starved.
Precisely. And here's the clinical kicker. You can have clear clinical signs and symptoms of zinc deficiency, even when the serum zinc level falls within the so-called normal range.
That's really tricky. It makes the clinical picture even more important.
Exactly. Think of serum zinc like the level of a river. It might look okay on the surface, but it doesn't tell you about the deep underground reserves, the tissue levels. Those reserves could be low even if the river is flowing normally for a while.
That's a great analogy. So a normal blood test doesn't rule it out if the picture fits. You need that high index of suspicion.
You absolutely do, especially in those high-risk groups or if you see those classic signs. It's driven by clinical judgment, supported by labs, but not ruled out by a single normal number. That's vital.
Got it. Okay, so you've put it together, made the diagnosis. How do we fix it? Management.
Thankfully, management is fairly straightforward. It's essentially a two-pronged attack.
Okay.
1, treat the underlying cause. You have to figure out why they're deficient. Is it diet, malabsorption, alcohol? You need to address that root problem.
Makes sense.
And 2, zinc supplementation. Give them the zinc they're missing.
Simple as that. Treat the cause. Give the zinc.
Pretty much. And alongside that, dietary advice is crucial too. Help them maintain adequate intake long-term once the deficiency is corrected.
Right. And the outlook. Prognosis.
Generally good if caught and treated properly. Supplementation and addressing the cause can reverse the deficiency, and symptoms often improve significantly.
That's encouraging.
It is. But, the ultimate prognosis depends on how severe it was to begin with and whether any irreversible complications, like perhaps severe growth stunting in a child, have already set in.
So early treatment is key for the best outcome and prevention.
Yeah, for those at risk, long-term monitoring might be needed, and generally promoting a balanced, zinc-rich diet is important for everyone.
Because if it's not treated or it's severe, there are serious complications waiting down the line.
Absolutely. These are the things we really want to avoid. The notes list impaired immune function as a big one, leading to recurrent or severe infections.
Right.
Delayed wound healing becomes a chronic issue. Significant growth retardation in children, which might not be fully reversible. Lasting cognitive impairment. And just generally being more susceptible to infections.
These are serious, potentially life-altering consequences.
They really are. Which just hammers home why early diagnosis and management are so important. It's about preventing these long-term health problems and improving quality of life.
So there we have it. We've gone from defining zinc deficiency, understanding its huge range of roles, digging into why it happens, who's at risk, how it messes with the body.
How to spot it, those common signs and the really classic high-yield features, navigated the tricky bits around diagnosis and lab tests.
Covered the straightforward management and looked at the prognosis and what happens if it's missed. It's quite a journey for one trace element.
It really shows how something seemingly small can have such massive widespread effects. It's a reminder, isn't it, to keep these smaller deficiencies in mind, especially with patients who have confusing multi-system symptoms that don't quite fit neatly into another box.
Absolutely. Look beyond the obvious. It definitely rewards careful observation and that high index of suspicion we mentioned. Well, thank you for joining us on this deep dive today.
My pleasure. And if you listening found this useful for your revision, maybe for MSRA prep or just general learning, there are loads more resources notes like the ones we used, more deep dives available over at pathsra.com.
And also at freemsra.com. That's passthemsra.com and freemsra.com. Definitely worth checking out. Thanks again for listening.